Hi, I'm Cheyenne. In the spirit of it being October, I decided to discuss breast cancer awareness for my informative speech. According to the National Breast Cancer Organization, 1 in 8 women will be diagnosed with breast cancer in their lifetime. It is the most commonly diagnosed cancer in women and the second leading cause of cancer death in women. It is more than likely that you know someone currently struggling with this kind of cancer or someone who is in remission. The two most important aspects of being knowledgeable and aware of breast cancer include prevention and diagnosis, as well as treatment. In regards to prevention, Mayo Clinic states that some lifestyle choices can help reduce the risk of developing breast cancer. Some of these choices include limiting alcohol, not smoking, controlling weight, being physically active, limiting dose and duration of hormone therapy, and generally avoiding exposure to radiation and environmental pollution. These methods of prevention aren't completely foolproof, however, and things such as family history could be a risk factor that can't be helped because of this. It's important to make use of methods to monitor and screen for breast cancer. This way, even if a person develops the cancer, they can help better the prognosis by diagnosing it as early as possible. Screening tests are done for people who are believed to be otherwise healthy. An example of this is a yearly mammogram, and this is vital to staying on top of diagnosing breast cancer in the early stages. Diagnostic tests are given when a person is suspected of having breast cancer. A test like this most often includes a biopsy of the breast in order to further analyze the tissues. Tests like this can then effectively lead to diagnosis and treatment. An important type of basic screening is often taught and suggested by a woman's physician, and this is breast self-examination. Physicians encourage women to do this at least once a month as to be able to monitor themselves in between the yearly mammograms, and so that they can note any changes or differences in their breast tissue as it occurs. Some things to pay close attention to are swelling of all or parts of the breast, skin irritation or dimpling, nipple retraction, redness, scaliness or thickening of the nipple or breast skin, and nipple discharge other than breast milk. Though these symptoms alone may not mean that the person does indeed have breast cancer, they're still important changes to note to a physician. There are several types of treatment, and in cases of breast cancer, local treatments focus primarily on treating the tumor, and this can include surgery and/or localized radiation therapy. Local treatments are most often useful in early stage breast cancer. The second type of treatment, called systemic treatment, affects the body in its entirety, and these treatments often include chemotherapy, hormone therapy, and breast cancer survival rates can be considerably high if diagnosed and treated as early as possible. According to the American Cancer Society, the 5-year survival rate for women diagnosed with early stage breast cancer can be between 93 and 100%. This is why preventative and diagnostic practices are so important. Early detection can lead to the highest survival rate and best case scenario for a person. No matter what predisposition you may have and no matter how healthy you are otherwise, breast cancer can affect anyone. Be proactive in the preventative measure you take, and be sure to get your yearly exam. It can make a world of difference in preventing an early diagnosis of breast cancer.